Hello, I'm Dr. Daniel Wai and welcome to this episode of 5-Minute Diabetes. Today, I will want to talk to you about diabetes mellitus and its complications. So, what is the problem? Also, what's the big deal if I have diabetes and I don't really care about it? Well, of course, this is a theoretical question. None of my patients ever actually say that to me, to my face. But it must be something that goes on in your mind. So what is the problem if I just want to enjoy my life and, have diabetes and not bring it under control? Well, there are these things called complications of diabetes. So what are the complications of diabetes? Well, complication of diabetes mainly is caused by two things. There are two main types of complications. One is called the microvascular complication, and the other one is called the macrovascular complication. Okay. So it's too difficult. You need 5 years of medical school to understand it. So basically, small blood vessel problem, big blood vessel problem. And they're a bit different. So the small blood vessel problem is because of the primary problem of high glucose, sugar. Okay, so what happens when we have a lot of sugar in the blood? And it is going around, it actually attaches itself to all the things in our body. For example, all the proteins on the blood vessel walls, all the blood vessels in the kidneys, all the blood vessels in the eyes, all the blood vessels around the nerves. So what happens when all these blood sugar get attached to those proteins in all those areas is a problem of the function of those things. So, for example, if the blood glucose attaches itself to a certain thing, white blood cell, the white blood cell doesn't function normally. If it attaches to a blood vessel wall, the blood vessel wall tends to get narrowed, clogged with cholesterol. If the blood glucose get attached to some of the other protein, it will change the look of the protein and other problems. Okay, so what problem does it cause? In the eyes, in the kidneys, in the nerves. These are the three main areas of what we call the microvascular, a small blood vessel disease. Okay, so what happens is that when the blood glucose is high and damage the blood vessels in the eye, what we call the part of the screen in the eye called the retina, is that the retina would either have narrow blood vessel and then sometimes a part of the retina dies. So other times the blood vessel become weakened and then it bleeds in the eye. So all these changes, if it happens around the area that we see called the fovea or the yellow point, then we won't be able to see clearly. And when some of you who have diabetes go for this screening of the fundus photo, which is a photograph of the picture behind our eyes, and this is really to have a look at what is behind the eye in the screen. So it is what we call eye problem. If the diabetes is affecting the kidneys, it causes problems in the kidneys, the small functioning unit called the glomerulus. And then it causes damage to the glomerulus, causing protein leaking, and then finally dysfunction of the kidneys. Then lastly is the nerves. And when it happens to the nerves can get inflamed, the nerves can die. So that sometimes when you do a nerve conduction study, the neurologist send you because of numbness, and then you find that actually there is also inflammation, and then the layer that is insulating the nerve is stripped off, or the nerve is actually damaged and not functioning properly. So diabetes, in simple terms, the complication for the small blood vessel can be problem with the eye, problem with the kidneys, and problem of the nerves, sometimes leading to amputation of the feet. And then there's the big blood vessel problem. The big blood vessel problem is primarily related to the whole person. It's more related to the obesity that is associated with diabetes, also the high blood sugar, but also the sedentary lifestyle and the obesity. So it is a bit different, and that is associated with stroke and heart attack and heart disease. So that's all for today. Thank you, and I'll see you again for the 5-Minute Diabetes. I'm Dr. Daniel Wai. Bye.